Good afternoon. My name is Dr. Matiko Giabe. I'm the County Director of Medical Services. Today marks a significant day for this county, specifically the Health Department of Health. The County Department of Health have joined the rest of the 15 counties in the country to launch the use of lenacapavir, which is a drug that is taken to prevent acquisition of new infections to our key populations. We've received enough doses for our county, close to 500 for starters, and we expect to be receiving more doses. It's a drug that is an injectable and has undergone various trials in the past and has been approved by the relevant regulatory bodies as safe and effective to prevent new infections. So I want to make it clear to our population that this is not a trial drug. People are not going to be used as guinea pigs. It has been approved to be effective, and therefore everyone receiving it should have the confidence to come forth and get the injection. Lenacapavir comes as an injection of 2 vials as well as 2 tablets. So the injections are done on the first day at 2 sites, subsequent to which the tablets are given, and 24 hours later another tablet is given. And prevention of acquisition of an infection starts around 48 hours. So we want that to be understood, and there has to be a repeat injection 6 months afterwards to sustain that protection. Having said that, I wish to remind our populace that there are other infections that could be acquired that are not protected by lenacapavir, and therefore the other preventive measures, the barrier methods, and other PrEP measures need to continue. To our young population in the reproductive age group, it's also important to know that lenacapavir is only for prevention of new acquisitions of HIV infection and do not prevent anyone from conceiving, and therefore necessary preventative measures ought to be taken. Our healthcare workers will be available to support anyone who wants to get this drug. So here at Getembe, we have around 44 doses, and we have a few members from the public receiving this dose. And we'll be availing a list of the other 10 facilities within the county which will be stocking these drugs for access to those who wish to get these services. Thank you.
You spoke about the number of infections and deaths related to.
So the current prevalence of HIV in Kisii County as of the 2025 data is at 2.9%. Women affected slightly more than the males. Last year, the new infections were 359, and we had 310 deaths as a result of HIV-related complications.
For someone who wants this injection, free or
No, as it is now, it has come under an access program, so the injections are absolutely free. So we have a number of facilities. I could build that for you. One of them is Getembe. We have Keumbu. We have our main hospital at Kisii Teaching and Referral Hospital. We have Bucha, Iabe, Magena, Cheki, Duru, and Gesusu. So those are the initial facilities, but as we expand the program, we hope to bring on board more facilities.